So this is a presentation just to review a lot of different items around safety protocol that we've discussed over the months when we started our planning for in-person learning really in May and June, as we were hoping we'd be able to open in a hybrid environment to start the school year. So this puts together some of the things and some of the areas that have evolved as we've learned more about the COVID-19 and safety measures that can be taken. It's not for board action. It's really just to kind of present and summarize some issues for any board discussion, input, or direction as we further prepare for more and more students on campus. And let's see if I can. So the basic presentation outline, I'll quickly review the public health COVID-19 status, which is trending in the wrong direction. Talk a little bit about where we get our guidance for safety, the direction we're going with pre-screening for symptoms, COVID-19 testing, PPE, physical distancing measures, personal hygiene, cleaning, disinfection, indoor air quality and ventilation, how we'll respond to COVID-19 symptoms on our campus, how we'll respond when we have a COVID-19 positive, and public health officials keep telling us it's not if, it's when, contact tracing and quarantine procedures, a little bit about athletics, as that's, there are a lot of questions about where we are with that. Lunch and food services, although I'll just very briefly talk about some of the safety measures to keep students safe, and Ms. Bautista and Ms. Ward will do a presentation on our food services. Talk a little bit about our community compact, which is an agreement that we'll expect all coming on campus to sign and agree to. And then just a little bit about the training and orientation to get all of these procedures running safely. So a little bit about our current public health status. As I mentioned, it's trending in the wrong direction. And just from yesterday's report to today's report, the cases per day went from 5.5 to 6. You can see down in the graph, the blue part is 7 days ago, and the gray is the data as they are coming in on the more recent days. So it is definitely trending in the wrong direction. The testing positivity rate is still not outrageously high, but again, that was below 2, and it's kind of trending up a little bit. So the state metrics, the state every Tuesday updates their tables. This week they had some data problems, so they didn't update until today. And you can see, I probably put too much on this slide, it's really busy, but on the left is kind of the metric for Contra Costa County. So remember that today the report came out for November 4th, and that's based on data from 10 days ago. And so Contra Costa County, it had our new cases at 5.7, adjusted down to 4.8. And again, that adjusted rate of new cases is due to the rate of testing. So counties that are testing much more will have a rate adjusted down. And so 4.8 is the number. So if you look on the right, that's the basic table. And you see the red or substantial is between 4 and 7.0. So our data are in the red substantial level this week. Down at the bottom on the left-hand side, it's our current 11.4 is moderate. And again, just as we had to be in the orange for 2 weeks before we became orange, we have to be in the red for 2 weeks before we were converted to red substantial again. So our health officers mentioned on a call on Monday that there was a a good chance that on November 10th, we will be back into the red substantial. Speaking of the health officer, they put out a press release today announcing some changes on restrictions starting on Friday. Some of the things that were opened up with orange, they're going to dial back a little bit with their concern of the data trending up a little bit. So not great news, but it's good to see that our county is being proactive and they're tightening things down. And as community members, we all need to remember that we must mask and we must stay physically distanced. We must behave ourselves, or this trend will continue in the wrong direction. So the guidance for safety protocol is really taking from our local county health officer and his staff, as well as two primary documents. One is from the Contra Costa County Office of Ed on school reopening guide, and that was developed in consultation with Contra Costa Health Services. And the other one for all schools in the state is the guidance for school and school-based programs. And these links are active if anybody wants to look at those documents. We've shared them many times before. So moving into some of our safety protocol. So we are using a passive pre-screening protocol prior to anybody coming on campus. There are some businesses and some places and some schools that were on the news that show active temperature screening as students enter the campus. The literature is pretty clear that that's not an effective way to prevent COVID-19 spread on your campus. And so our county health services recommends a passive temperature and symptom screening, meaning people are responsible for doing their temperature and their symptom screening on their own. So all staff and students that come on campus will participate with a passive pre-screening, and we're using a system called Company Nurse, and it will send a daily notification text or an email notification that will prompt people to pre-screen, and it comes out about 7:05. And the screening questions are consistent with the CDC and California Department of Public Health and Contra Costa Health Services guidance. You will need to have a green status to be on campus, and it's something that you can show on a phone, or it can also be shown from a device through the web. If you have red status, you will be instructed on to stay home and who to contact to figure out next steps and seeking health care. So I did my pre-screening this morning at 7:05 when I got my notification, and I took a couple screenshots just to share what it looks like. This is something that we are rolling out with staff. We've had some staff piloting it the last couple of weeks. We're rolling it out with all staff next week, and then with students will follow shortly after. It was mentioned by one of the student reports that students are doing a hard copy pre-screening system right now. And so they'll be moving from that hard copy pre-screening to this digital version. So the first thing it asked me is to make sure I didn't need to call 911. Which is always good to, if you might have some more severe symptoms. And then it goes through asking about the basic symptoms of COVID, and you answer yes or no to that. And then the last question I received this morning is whether I've had any close contact with a known positive. And then if I answer no, I submitted, and I passed per CDC. And again, if I had not passed, it would have instructed me, if I'm a staff member, to call HR to receive further instructions, or if it's a student, to call the attendance office for further instructions. And then I get something like this, which is what I could flash to people. If I'm a student, I'd be able to flash to show that I've pre-screened. staff would be monitored by the school site to make sure they were pre-screening. Company nurse has been very responsive. Nick Carpenter is leading this endeavor for us, and they've been very responsive to him. For example, one of our requests that they are modifying the next version is the date is not large enough, where we want that to be larger, the date that it says your status is okay, and they're going to do that. This will, if I kept this on my phone as green, it would become yellow over time, so I wouldn't be able to reuse it the next day. What we like about the system is it gives you the daily text or email asking you to complete it. Okay, the next area is our testing, COVID-19 testing. So we will participate in surveillance COVID-19 testing for asymptomatic COVID-19 carriers. And this is something that is recommended by the California Department of Health as well as the Contra Costa Health Services. And they recommend that all school staff is tested at least once a month, either through health providers, their school if available, or at one of the county's free testing sites. We are in the process of implementing a surveillance testing program for all employees at a much more frequent basis. It could be as frequent as once a week, but certainly aiming for once every 2 weeks. All staff will be tested as part of a surveillance program. And asymptomatic staff do not need to quarantine after testing. Certainly if it were positive, they would need to then go into a quarantine. But if just because they're testing doesn't mean they need to quarantine. Now, students and families, there's no requirement for testing coming from the health services or the Department of Public Health, but it is recommended that there's regular testings. And so students can be tested through their healthcare provider or at a county free testing site. We are planning to try to arrange for some COVID-19 surveillance testing opportunities for students and families, perhaps once a week or once every 2 weeks at each school site. We'll offer something, but we have not secured it at this point. We're still talking to vendors about that possibility.
John?
Yes.
Is that going to be the spit test, or is that going to be, do we have decided which kind of test that is going to be, the rapid one or PCR or what?
So we're talking about some different vendors, but all of them are, I believe, a PCR and are a 24 to 48 hour. And although one of the vendors that the county has a contract with that we might piggyback on is actually taking swabs inside the mouth. It's a self-administered inside the mouth, but then it's a PCR, so it's a little bit different type of test, but it's starting to be pretty widely used in school. So that's one we're looking at.
Just to clarify what your question was, though, Chris, were you asking about the type of test for the faculty, the staff surveillance program, or the potential one for the families, or both?
I answered for both.
Okay.
So what we're looking for is a system for staff.
It'll be one system.
Well, we
for both.
think
Oh,
at this
okay.
point
Cool.
that what we'll do is develop one system for staff, and then we're working with them to see if we can also make it available for people in the community who are interested. And so again, that's a work in progress right now, but that's our interest to do that.
Thanks. I was confused.
Okay. personal protective equipment or PPE, the primary one we're talking about is the primary one that we're talking about is masking, although there's some other areas that we're looking at. And of course, the schools are doing their different ways of promoting the importance of masks on the campuses. So most importantly, with face coverings or masks, all students, staff, and visitors over the age of 2 will wear face coverings, nose and mouth, at all times while they're on campus. You know, with the exception of momentarily taking off a mask to eat or drink during lunch or other times when they're physically distanced, when staff is alone in a room, or if they're exercising while physically distanced, which we have happening in some cases right now. There is an exemption, a medical exemption from wearing a mask. So if there is a case, we would work with the students, and you know, there is California Department of Public Health does recommend a face shield with a drape at the bottom edge as one alternative, or it might be something where we need to encourage that student to stay on distance learning. So that will work with individuals. This was a question at our last board meeting. If people fail to wear a mask, we would go through progressive discipline. Whether it's a student or staff, they would be instructed to change their behavior, and it could be ramped up, and eventually a student could be excluded from in-person learning if for multiple failures to wear a mask. And of course, the school will provide a face mask should a student or staff member forget to bring a mask. We have a large inventory because the state provided masks to the school. So we have a large surplus at each school. This is just some of the signage that's going up at the schools. Just a couple clarifications on the masks. CDC has reminded us that 2 or more layers is best, and the mask must be worn over the nose and mouth. And we are not allowing gaiters or bandanas. There's more and more research going on that, but it seems to indicate they are not adequate. And also wearing masks with exhalation valves or vents that are not filtered and allow the virus to be exhaled. And we're going to ask our students to clean their masks with soap and high heat on a frequent basis. And that's just kind of one of the graphics. I think the under the nose is something we'll see. We need to correct students on that. Certainly the chin strap is something that we'll see out there, which is, I think we all find an annoyance, but we'll need the students and staff to wear masks correctly. We do have plexiglass barriers. At this point, we are not putting them around each student workstation, but they're in our offices, and they're also around teacher workstations. We might put them in some select places like lab benches, where students might be, they'll be 6 feet across, but working from across each other, facing each other. So we'll continue to explore that. And gloves will not be used frequently, but there will be times when, because of shared equipment, the teachers might direct students to use gloves, and those certain staff will be using gloves as a standard practice as they do their work assignment. So one of the big safety areas is maintaining physical distancing. And so we are going to keep our standard at 6 feet of distance between students, staff, and students, and staff and students, and it should be staff and staff. The county guidance does allow for 4 feet between students, but we will keep that aim at 6 feet. Part of our physical distancing will be to de-densify our campus. And so our hybrid learning model, reducing the students by approximately half, and perhaps a little less than half on campus each day, will be one of the major ways we do that. We still get questions from the community, how come we can't bring all students back on campus? And it's because we would not be able to maintain the 6 feet or even 4 feet a distance between the students. And that's why the hybrid learning model is the only viable model, probably through most of the year. We certainly would hope for changes in the spring that would allow us to bring everybody on campus. But right now, when we need to maintain that distance, we need to do the hybrid model. So we're reducing classroom density. So a classroom that typically sat 30 students will now have seats for 15. We have signage for directional traffic flow. We'll have some kind of key moments of staggered arrival and release in our schedule. Lunch and break times will have targeted efforts to keep physical distancing between students. And our bathrooms are going to be restructured a little bit. So we have fewer students in at a time. There's fewer urinals being used. There's fewer sinks being used, so that we have less density in our bathrooms. Supervision of our students will need to increase significantly. And I believe we're interviewing for additional campus supervisors currently, and we'll have them in place within a very short period. So we'll have more eyes on campus along with administration, making sure that people are following the physical distancing as well as masking requirements. So just an example, here's one classroom. In this classroom, they made the choice to pull out many of the desks, but this is a smaller classroom that I believe has 13 or 14. Each room is being labeled with the occupancy of the teacher and the students. And they've tried to optimize by the square footage, getting the maximum number of desks that they can while maintaining physical distancing of 6 feet between students and between the students and the teacher. These are a couple classrooms where they left the furniture in. The furniture can be left in the room for a couple of reasons, one of which is to create barriers so that desks are not moving towards each other. And also, frankly, because storage of half of the desks in all our classrooms is a challenge. But we would move them out if we thought it brought benefits. But in many cases, we think the extra furniture can create barriers so that desks don't start sliding towards each other. And then what they're doing in the classrooms is labeling desks. Here's one from Miramani: the space must remain empty for physical distancing. So in specialty rooms, for example, on the left, that's an art room where the art stations, about half of them have been pulled out, or some were spread into an extra studio so that we could keep distance. And then the lab stations, most science rooms will actually use the lab stations for additional seating for students. But then also they're kind of taking corners of the lab stations and marking them off as an area that's not to be used, so that the students can keep their 6 feet distance. And as I said, we're looking at possibly putting a plexiglass barrier in between, since although the students are 6 feet apart, they will be facing each other. And just with the de-densification, if we have 5, 6, even 700 students on a campus at once, the flow of traffic will be important. And it will be one of the reasons why we really will need to bring students on campus just for a new orientation. So the first two pictures are just showing some of the unidirectional flow through hallways. And then there's one where we felt it was wide enough. It's almost about an 18-foot wide concrete, and they felt they could go both ways through double sets of doors. And just inside in some classrooms and offices, there's directional signage to keep the flow going in one direction. And then we have mats on the ground, signs on the ground telling people where to stand when they're waiting. So The top right-hand corner is just an example of where a student needs to stand if they're asking for extra help from the teacher to stay 6 feet away. So good hygiene and health practices will be critical. So we will be encouraging and providing some training on simple things like washing hands. We have lots of hand sanitizer in place when washing is not practical. So in each of our classrooms, there's either 1 or 2 of the hand sanitizer dispensers that we're going to be asking all students and staff as they enter a classroom to take a squirt, and as they leave to take a squirt, and custodial staff will be refilling each night so that it stays stocked. Obviously, avoiding your hand contact with your own eyes, cover coughs and sneezes with an elbow, even when masks, and stay home when sick is going to be critical. And then we'll be encouraging immunizations. The flu vaccine is something we hope that all of our students and staff will experience. Pictures on the right just show a couple hand sanitizers. One on the left is just a standard one in the classroom. The one on the right is in an office area where there's a pen, a new and used pen, as well as some wipes and the sanitizer. Then down at the bottom is a bathroom, just encouraging good hand washing technique. But I will say that that bathroom we will be blocking off every other sink, and so it will be a little less dense in there. Just a little bit on cleaning, disinfecting. We've provided some information to the board previously, but we'll have a reduction in shared items that need disinfecting. So, for example, water fountains are blocked off. We'll leave our hydration stations where students can fill water, but the fountains will be blocked. A lot of equipment that we normally share, we simply won't be. We'll have ongoing cleaning and disinfectant of frequently touched surfaces during the day, door handles, sink handles, bathroom services, etc. We'll be disinfecting shared equipment between use. So there might be some classrooms that have hands-on, whether it's an auto shop or a science lab, and then we'll have systems to disinfect in between use between different students. We'll have a classroom workspace transition cleaning. So students will have a role in this where personal workspaces will have systems for our students to wipe down their spaces before and after use in a classroom. That's one of the things that's necessary in a high school environment where you have multiple students using the same classroom with just a short break in between, given that we simply don't have the custodial staff to do it. We would need almost 1 custodian per classroom available throughout the day. And so we're going to be asking our students to take a role in that wipe down. We'll do deep cleaning of every used classroom every evening, and we'll use 360-degree contact cleaning, which is the kind of the charged fog machine that surrounds surfaces. And we'll use that in kind of special places that need a little bit deeper cleaning. We are hiring additional custodial staff to be around during the day, and they are being provided with additional PPE for their own protection and safety. We did a lot of work on our HVAC system during the summer in terms of the mechanics of them, and through the fall with more and more teachers on campus and students, we've been fine-tuning some of the programming. We did install MERV 13 filters on our HVAC units. And MERV 13 is what's typically found in hospitals or healthcare settings, not the operating room, but the general spaces. And we are not able to use HEPA filters, which have a higher filtration just simply because our HVAC systems are not designed for that. The board approved the purchase of the needlepoint bipolar ionization devices over the summer, and those have been installed in virtually all classrooms. And these devices will kill some pathogens, including some viral particles. And the particles that can flow through will be reduced because they kind of conglomerate together and then can be filtered out. So that was something that was useful when we had the poor air quality through the fall. And it will also help should there be the coronavirus in the air, and in some cases it can kill. We do have some HEPA standing filters throughout the schools in areas where we have multiple people in closer quarters. And so those are operational, particularly in some of the office spaces. And one of the big pieces, and this had to do with the programming of our systems, is increased airflow and a continuous fan. And so the fan will be operating at all times, whether the air conditioning is on, the heat's on, or if it's just a fan circulating air. And we have maximum outdoor air exchange, so as much air as possible coming from the outside. Okay, the next section is just a kind of our planning for procedures in response to symptoms and positives in our community. So if there is a staff member or student or even a visitor on campus, they must do the pre-screening and they must stay away if they're sick. But symptoms can have an onset when they're on campus, and should they, we will train students and train staff who they inform, and then we have an isolation place on each campus where they will go and remain masked. There will be supervision for a student, but they will remain masked, and then we will contact to have a parent come pick them up, and with a suggestion to consult with a healthcare provider. If it's a staff member, depending on the degree of systems, they would be either driven away, or somebody would pick them up, or they drive home. We will require a quarantine for 14 days, or they would need to obtain a negative COVID-19 test and return when symptom-free for 24 hours. So a lot of people worry about if we have a positive case. And again, as I mentioned earlier, public health reminds us, and we've seen in virtually every school that's open, it's not if you have a positive case, it's when you have a positive case. And so if we have a positive case, we have a site contact tracing team on each school site, when it's a nurse and some members of administration. They would be notified, and that could come from Contra Costa Health Services. If there is a positive test in the county, they'll be notified, and then they would contact us. We hope that a parent or student or staff member would inform us prior. Now, when we have our own testing in place, we will be notified through that. So the site contact tracing will be notified somehow that there is a positive. And of course, that positive person should remain at home, and then our contact tracing team will work with district staff to trace contacts. And a positive contact is somebody who has been within 6 feet for more than 15 minutes over a 20-hour period of time. So if it's 5 minutes here, 5 minutes there, and another 5 minutes, that would be a positive contact if they're within 6 feet. So if there's a positive contact in a class, in a member of a classroom, the entire classroom will not be considered a contact. Only those that were within 6 feet or about 6 feet away for 15 minutes or over. And so that would not wipe out an entire class. It would just wipe out the close contacts. And I shouldn't say wipe out, it would just put them on quarantine. So contacts will then quarantine for 14 days. And that's regardless of a test. They will be out for 14 days. This Dr. Severson.
Yeah, just question on the on that part of it. That seems like a lot to me, and I'm not sure if that's guidance that or where that comes from, but I mean, that's certainly way more than we do in the hospital. I mean, on the 1 point, contacts are decided 6 feet, 15 minutes over a 24-hour period without PPE. So that's one thing that's different. And then also to quarantine for 14 days from a known exposure, again, that seems extreme to me, especially if there's a possibility of getting a negative follow-up test or something like that in the interim.
Yes, and I don't disagree with you. That's coming directly from the public health officials that are calling for that in the schools. But 14 days does seem like a lot, and I think the notion is that because of the time it could take for the virus to be affecting the individual or show up in a test. But the county health services is very clear on that piece, that is 14 days. And it's one of the reasons with our hybrid models, we're trying to make sure that there's ways for students to easily access the curriculum. But I'm happy to kind of push back on county health services, but they've been really clear in that parameter so far. But I can ask a little bit.
Yeah, one thing I would push back on them on that point, because you certainly seem like there's going to be a lot of people that are going to be motivated to get back to school. They're probably not going to be sick. And so the typical recommendation from like the CDC is to be tested 3 to 6 days after exposure. And if you're negative within that window, you're clear. You can't be tested like the next day, but 3 to 6 day window, and then returns. I would push the county on that for sure.
Yeah, I will. And as you mentioned, one of the things that some people don't understand is the positive contact in schools is masked or unmasked. And so it although we anticipate all are going to be wearing a mask on our campuses, but
yeah, so just to clarify, so is it that Contra Costa Health Services, so are they requiring that even after a polymerase test, say 3 days after, if someone tests negative, they are still going to have to quarantine the full 14 days? That's the requirement, not the recommendation?
correct. And that is something that we've lived, not with students, but we've had staff members periodically in the last 4 months when they've had, were identified as a contact with a positive. They had to stay out for 14 days, regardless of negative tests and regardless of being asymptomatic. So I'm certainly happy to try to push back on county and determine whether it's their local determination on that or whether it's coming from state Department of Public Health and on that rule.
And I'm happy to talk to them as well.
They've certainly offered to talk to any board members, so we can set that up and have a joint call. There was law passed that requires us to notify all parents and students and staff members in a school or building if we do have a positive case, and that's something we would do anyways, but the law now requires it. And the other thing I'll mention is that confidentiality will be maintained throughout this process. If we inform you that you're a contact and you need to go on quarantine, we don't tell you who you're a contact with. Certainly the contact tracing team at the school site will know that. The district office, people involved will know that, but we won't tell the contact who it is, which certainly can be frustrating for people, but it's important for the confidentiality. Okay, just some scenarios that are presented by County Health. And Dr. Severson, you might not see eye to eye with some of these, which is fine, and we will bring these back to the county. But they presented some scenarios in the training of our contact tracing teams from our school sites went to training, as well as folks from the district office, and they presented scenarios to help them understand. So scenario one is you have student, kind of talked about this, student or staff with COVID-19 symptoms at school. And so you send home, you recommend testing, and the school and classroom remains open, and we don't need any communication from there. So they would need to produce either a negative test and be 24 hours from 24 hours from symptoms to come back. So scenario two, they have student or staff is close contact with a confirmed COVID-19 case. So this is what we were just talking about. And so send home, quarantine for 14 days from last exposure, not allowed back into school for 14 days. Recommend testing, particularly of symptoms, but that does not shorten the 14 days. Now, this is the interesting piece. If positive test during quarantine, must isolate 10 days from symptom onset or test date, whichever is more. And school and classrooms remain open. Scenario three, student or staff is confirmed COVID-19 case infection. So action, we need to notify Contra Costa Health Services, or they will be notified by whoever administered the test, but sometimes we can get to them first. Isolate the case, and they get excluded from school for 10 days from symptom onset or test date. We identify close contacts, we quarantine and exclude exposed contacts for 14 days. And then we disinfect and clean any classrooms or primary space where they spent time, which is something we'll be doing every day anyway. The school remains open, and in this case, we are required, and again, we would do it anyway, to notify all, both exposed and non-exposed in the school. So scenario four, student, yes. Yes.
Yeah, so just to be argumentative, I mean, that points out one more thing. I mean, so potentially you could have someone that's test positive and they're back in school before someone that's contact in 14 days. So again, that makes zero sense.
Yeah, and I don't disagree with you. And I will tell you from personal experience, I have a child who's a freshman in college, and he had a friend test positive. And that friend was on 10 days at that college. He was on my son was on a 14-day quarantine, had 3 negative tests during that period, but they kept it at and that was policy developed by one of the leading public health schools in the world. So somehow the science can defend it, but we can certainly push back. But
They add the 14 days for onset.
From where the 14 days from the exposure.
Right.
Yeah. But Chris, I don't disagree with you, and it was incredibly frustrating as a parent to go. So this is just a student or staff goes home because they have symptoms, they test, they're negative, so they can return to school 24 hours after symptoms resolve themselves. So scenario 5, student or staff is in there's a word missing, in a house. Student or staff is a household member of someone who is quarantined. So they are a contact of a contact. So that would be, for example, somebody's mother was a contact to somebody at work who was a positive. So in that case, nothing needs to be done. They should be encouraged to monitor for symptoms. And certainly if the household member becomes symptomatic or tests positive, they would go on quarantine. Okay, so those are just some scenarios that, again, our contact team went through training about 6 weeks ago on those. They have another training session in a couple weeks. Initially, the Contra Costa Health Services was going to try to contact trace all the schools. They realized they didn't have the staff to do that, so they figured they would train the school sites, which we're grateful that they have. One of the things that we will be doing as we have more and more students and staff on campus is we'll be developing a dashboard that will be available to the community for full transparency. The one example I give here is from Rockland Unified. It's probably the most extensive I have seen. Most of them just do number of students, number of positive cases, and give you a percentage. And I'll tell you why that percentage is important. But Rockland is very ambitious in what they're doing, and it's incredibly transparent. So this shows the actual positive cases they got during that 1 week. And this is a district of about 10,000 students, so a little bit bigger than we are up in Rockland. They show the exposures to the positive cases. And then they show the situation where people have symptoms and they're home from school with symptoms as those get resolved. So I think we all know as we enter the winter months, there will be more and more sickness that maybe isn't COVID, but might resemble COVID, and students will have to go home until the symptoms resolve themselves if they have a negative test. So we will be developing something like this, but it may not be quite as thorough once we get more and more back on campus. A lot of people ask, at what point will you close the school? And so certainly if we seem to have quite a few cases of positive, we'll be working with county health. But the County Department of Public Health has given some guidelines, and that is if you have 5% of the teacher, student, or staff population with positives in a 14-day period, it's recommended that you close the school. So that's why a lot of the dashboards will actually have the percentage of the positives. And then if a district has 25% or more, which would be 2 of our 5 schools is closed, then the whole district would close. So those are just the guidelines on once you're open, if you get positives, at what point you close. And I think that there were a lot of questions and assumptions like, well, of course, if you get a couple positives on a campus, you're closing down. I don't think public health would recommend that. But every case could be unique. But certainly at 5% closure would be required.
John, by closure, they mean going to distance?
Yeah, I'm sorry.
Just wanted to.
Yes, I'm sorry for the closure can be misinterpreted, and we need to say closed for in-person learning, because certainly distance learning would continue in that case. I just wanted to address athletics a little bit because there is some misperception and related to safety protocols pertaining to athletics. And the biggest safety issues are whether they are allowed or not. I sought kind of clarification from the county health officer on Monday, and he said very clearly that with the public health guidance we currently operate from the California Department of Public Health, there will not be any competitive sports at any tier, whether it's purple, red, orange, or yellow. So CIF right now has a schedule. They put out a schedule, and NCS put out a schedule in July with the hopes that we would be able to have competitive sports starting in December, and with certainly games starting in January. Right now, our county public health and the state guidelines indicate there will not be if we are in purple, red, orange, or yellow. And the notion of us being less than yellow before January, I think, is not very likely based on what we're seeing and based on the winter months. That said, we can have some hope. Right now, CIF and California Department of Public Health are in conversation trying to provide some greater guidance, which we hope to get in the coming weeks. And with that, we anticipate kind of safety guidance for low, moderate, high-risk sports, where a low-risk sport might be golf or tennis. A high-risk sport might be football or wrestling. Moderate might be something in between. We anticipate that we'll get better safety guidance for conditioning and practicing. And we anticipate we'll get greater clarity around sports competitions. It might be possible that there'll be some agreements and new guidelines from California Department of Public Health that would allow some sport competitions in a certain tier. Again, right now it is not allowed. So we have coaches that think season is starting on December 7th. We know at this point there will not be full practices on December 7th, that we will still be in a conditioning and a modified practice. Will games and contests be allowed in January? Currently, with the guidance and restrictions, the answer is no. Again, we can be hopeful that there's some changes, but right now the answer is no. Yep.
Has that been communicated out to our athletic directors, or I'm just curious if that's out there? I know some coaches are getting ready for, can't have equipment on that type of stuff.
Yeah, no, we've had, there's been some miscommunication, and so our athletic directors will be very clear going forward. You know, I think everybody wants to be hopeful. Everybody recognizes that for our athletes, sports is so important to their high school experience, just like other extracurriculars are important to students involved with other extracurriculars. And so everyone desperately wants it to happen and is maybe unrealistically hopeful. But again, we hope in the coming weeks we'll get better guidance that will fine tune down a little bit. And so Ms. McNamara, who's the former president of CIF, was on the phone with CIF a couple days ago, and I was in contact with NCS yesterday. And we're hopeful that there will be better guidance coming out real soon to give us greater clarity on some of those issues. So lunch and food services, I'll just mention kind of briefly on this because Ms. Batista and Ms. Ward will be presenting on it later. But we will be providing lunch regardless of the hybrid model when students are on campus. So even if we landed on an AM/PM model, we would provide grab and go. If we had students on campus for the full day, we would have it available. The free grab and go breakfast and lunch meals are available through June 2021. If you remember, the federal regs on that were modified, extending the program for June 2021. So that's available right now to all families for students under 18, and we're providing it to our partner districts, or four of our partner districts. Walnut Creek has their own program. And if more and more students are on campus and we're in the hybrid model, we will continue. So during lunch, if students are on campus during lunch, the physical distancing will be required during that time. And it's super important because masks will be temporarily removed, of course, when students are eating and drinking. So in order to do that, we'll be expanding the areas on campus that students can go, and we'll really be spreading out throughout the campus. And with that, it's part of the reason we need additional supervision, and we're hiring more campus supervisors to be out and about to make sure that all of our students are following what's in the community compact of the physical distancing and the masking. So related to the community compact, this is an essential piece of the safety as we bring students and more staff on campus. And it's really our commitment to each other. It's our commitment to the community that we will behave in ways that are will help prevent the spread. And so the compact, we discussed whether we want to roll it out right now, but I think we're going to be rolling it out with the students as they come back in January. And it will be part of their orientation process when they come back for in-person learning. And the draft community compact will be finalized in the coming months and distributed prior to January. And when I finish this presentation, I'll talk just a bit about the compact. And the last thing I've alluded to a little bit, we will have a comprehensive orientation and training program for all of our students prior to our hybrid learning in January, so that they have kind of clear understanding of the campus plans, rules, and procedures, hygiene practices and expectations, sanitation practices for their workspace and other areas, COVID-19 spread and symptoms, so that they have the full understanding of the how COVID-19 is spread. It would be an opportunity for our science classrooms to teach a little bit about that for students who aren't aware. So they fully understand the pre-screening that will be done through company nurse and physical distancing guidelines, masking, et cetera. Staff will be going through training and professional development kind of ongoing, and certainly before the hybrid learning model in January. They will need the time to develop the new practices and curriculum delivery for the hybrid, but they also need training on the school rules and procedures and plans. So that is a large overview, and the last thing that I'll report on before we do any public comment that is there and have any additional board questions is the community compact.
Dr. Nickerson, there is no public comment in there, just so that you know.
Okay, thank you. So the community compact is, this is a late draft version, and it's broken down into 3 parts. What are expectations for all students and staff and families before they come on the site? And the first piece is the self-assessment of COVID-19 symptoms. Second piece is doing the pre-screening system that I demonstrated earlier. Letting the school site know if a member of the household or the student or staff member tests positive. Consulting with healthcare provider about testing recommendations if the close contact. And abiding, this is a tricky one, particularly for our students, abiding by the county and state guidance for physical distancing, mask wearing in public, avoiding large gatherings and gatherings where attendees are not practicing appropriate safety measures. And I say it's a tough one because we do occasionally hear reports of large student gatherings, 100 or more people, not mass, and that practice will really undermine what we're trying to do. So we will be asking students not to participate.
Yeah, just to clarify, so since contacts, people who are contacted that person, the vector, since that person is going to remain anonymous, obviously there are going to be some breaches outside of school hours where students are going to associate. So say they might not have any classes together, but then they're associating with that vector in the days before, they have no idea who that is. Do we have any mechanism to try and inform contact tracing outside of school then?
Yes, great question. And that's where we'll be working with county health. So we'll be doing our contact tracing, focusing on the school environment and we might interview the student and say, who have you had close contact with outside of school? And then contact those people if we can, but then county health, if it's somebody who's not in our school system, county health would work to contact them and inform them. So again, if it were somebody, so for example, if Preston, I hope it doesn't come to be, you were a positive, and when you were interviewed, you said you were in contact with somebody at, say, Camp Alindo, another school. Our tracing team would contact that person and would not identify who it was, but would say that we have a positive case that was, within, and then that person would be on a 14-day quarantine. So, so yes. And then we'd work with county health if it were somebody outside as well. Okay, so then when students and staff are at the school site, there are kind of the expectations: physical distancing, the mask, sanitation practices, workspace sanitation, which I mentioned before, avoid unnecessary sharing, school procedures for school arrival, departure, and moving throughout the school, following the arrows, etc. And if the symptoms arrive, follow the procedures for isolation and next steps. And then the section kind of outside, and that's obtain periodic COVID-19. And so we'll have a district facilitated process for staff. And then for students, we'll try to provide some opportunities. Routine medical practices, annual checkups, again, encouraging immunizations, stay home when sick. So again, this is something we'll be rolling out, and we'll be looking for a commitment of all staff and students that are on campus. So with that, if the public comment, Ms. Glimmy said there was not, so.
Right. Yeah, I don't.
So we can have board discussion perhaps, or questions.
Right. Questions, comments? Ms. Coppersmith?
So I'll go, I did unmute myself. Okay. Go to the last piece first. I didn't know if we should, and I know this is a draft of the community compact, but you think that the wear face masks should be more specific, or at least something in parentheses, that because we know that there are some popular items out there that wouldn't be acceptable. So it doesn't come back and say, well, you just said face mask, you didn't. So
we've talked about that and struggle with a little bit about how much specificity we go into on this document, like outlining, not masks that have exhale ventilation, not masks that, no gaiters, no. And we thought to keep it more general here. And then through the training and orientation process, we'll have much more specificity, as well as kind of documentation and photos and video support that will go into the specificity. So that's kind of where we are right now, but we'll continue to visit it, because I think there's a balance between too much information in a document like this and yet not enough clarity. So
that makes sense. I just wondered if you needed it just to have to go back to and say, yes, it says face masks, but it's specific, just because I think that particular item may be a big issue. But I understand this is in draft. And anyway, and on the rest of the report, I'm amazed by the incredible detail and impressed with how much work has gone into it. So thank you.
Well, I think most of the credit goes to Amy McNamara and her work with site teams that have been fine-tuning the COVID kind of preparation. And there's been a lot of work over the last few weeks. And again, also working with some consultants who have a pretty deep understanding of the pieces that need to be in place to keep an environment safe. And so we're, there has been a lot of work that's gone
Other questions, comments? One tiny suggestion, it might just say approved face mask. Just as a, as a link, I mean, as a sort of indication that you have to make sure that it meets certain standards.
Yeah, I think that's a good way to do it, because as they continue to do research, an approved list could change, could become
Exactly.
broader, could become more narrow. So
Ms. Khan?
Ms. Connolly, we could not hear your comment.
Yes, I was muted. My violation of the Zoom protocol. I just want to echo Kathy Coppersmith's comments about all the work that's gone into the safety protocols. I did just have a question about what you anticipate the process is going to be for socializing the community compact between now and when we roll it out. And it's okay not to know yet.
yeah, so and that's part of the question. We thought about rolling it out now versus waiting. And there's certainly advantages to rolling it out now, but we thought we could do it in a more comprehensive way. We envisioned students coming on campus for training and orientation, and the signed community compact would be kind of their ticket to participate in that, and something they would have to do before they did the hybrid model. So we would do some promotional, probably videos about it, the kind of the why, the importance of it, and why it's an essential piece if we're going to have successful on-campus in-person learning. So that's the thought.
Well, just kind of as a quick follow-up though, I guess, are we pretty close, or are you pretty comfortable in saying that this is close to being finalized? Do you feel like there's more input that needs to happen from any key stakeholder group in our district? I guess was a little bit what I was getting at, if we have sign off from all the corners that should support this.
So far, it's been a document that's been reviewed by the administration and labor, and and the board. It's been at a board meeting twice now, but more of a review this time. And so I don't know if the board would like us to, maybe put together, I don't know if Preston, you'd be interested in kind of facilitating a student group to talk through it and talk through how you make a document like that real. I think that could be an good exercise as we think about deployment and promotion, and any tweaks that might be useful.
And also similarly, I'm sure coordinating council would be helpful on that as well.
Yep.
Great, thank you.
Yeah, so I'd be happy to help organize that if that was sort of a student version. But my question was off of what Dr. Severson said way earlier, which was about if we are using the polymerase test, which need very specialized equipment, go to a lab, 24 to 48-hour turnaround on that, and we're not having teachers quarantine, which obviously I understand we can't really have staff quarantining every time that they get a test, especially if it's more frequent, and more frequently the better. So have we looked into some of the other tests, not the antibody, but the antigen test that get those immediate results? Just because, of course, you can have a staff member contract the disease just a day after that test, and then it wouldn't be very useful at all.
Yeah, at this point, I don't think we've looked at the antigen testing, and I'm looking through Zoom at Ms. Bautista and Ms. McNamara, and I think I don't know the why, but we can certainly look at that. I mean, obviously the antigen testing is going to not have as reliable results, but at the same time, it's immediate. And to make sure, I think you got this piece, that the no quarantine is for staff is just when it's the surveillance testing. So there's no reason to believe that they might have it. They weren't exposed. They don't have symptoms. They're just doing surveillance testing. That's when we're saying there's no quarantine for staff.
I think when Julie and I were on a call with some of the testers, they told us an antigen wouldn't be ready, I think, till late January out of Quest Labs, like widespread for educators, like for schools. So it wasn't an option that I think we were able to look at right then.
Kind of on a related note, I'll just mention that just today, the state is unveiling a draft of what they're calling the playbook to stand up community-based testing sites. So you might recall the White House announced large funding to increase testing, including schools, maybe a month ago, maybe 6 weeks ago. And so that's rolling through California, and they have a new program with the Valencia Regional Laboratory received funding, and the state's supposed to add an additional 150,000 tests per day, which would double their testing, and they're looking for schools to be able to participate in that. So that might be something we explore as well. But that's not the antigen testing is either. It's PCR and 24 to 48. But we'll continue examining that because there are some positive benefits to the antigen.
Yeah, for this presentation you gave tonight, be accessible on the web.
It's on the board docs. Yeah, it's available. And we'll put it on our website as well.
Any other questions, comments before we? I just want to add my thank you to the working groups. Anybody listening to this, you have to start realizing how complicated it is. Not to say we aren't going to do it, but how complicated it is to safely bring everybody back onto campus. And thank everyone for putting in all the work, not just in the planning, but what will have to be ongoing work day in and day out of everybody involved, staff, students, families. Otherwise, we won't keep afloat. So hopefully everybody pulls together.
So just some kind of immediate next steps is we're continue to work at our school sites to make sure that they're ready. And our director of facilities, director of custodial are very involved with that, along with site COVID preparation teams that are working hard. And Amy McNamara's leadership has been essential. So we'll continue that. Dr. Severson will check in and maybe have a conversation with public health in the coming weeks to kind of push back and better understand why that standard is set for schools. And then Preston, I'll reach out to you and we'll figure out a way to organize to get kind of a working group of students to talk about the community compact and how to make it real and how we can roll it out successfully, and also look at the content if there's anything missing or things like that.
Great.